Why is it advised that people wash their wounds with water or alcohol if they get a cut or a wound caused by sharp objects? You see, bacteria is all around us, in the air we breathe, in the soil and in water, and even inside our bodies. But there are certain bacteria that does have effects on us and of which we should be careful about. Some of us might have got bitten by a dog or, have got wounds caused by sharp objects or scratches. And that's when doctors advise such people to take a tetanus injection. You may have experiences like that, I bet you do. Hello everyone, so my name is Aman Abraham and today we will be talking about what tetanus is and why we should know about it. So let's have a look. So what is this tetanus? There is another name given to tetanus and that's called lockjaw. Why lockjaw is given to tetanus is because the most common sign of infection we see in tetanus is the tightening of the jaw muscles. So tetanus, it typically arises from a skin wound that becomes contaminated by a bacterium. And there are different types of tetanus infections. And one of the killer diseases is the neonatal tetanus. So the fatality rate, it is as high as 80 to 90% with treatment. And the incubation period from illness to exposure is about 6 to 10 days. But it depends on the kind of wound. So it may range from one particular day to several months. So what causes this tetanus? As we discussed in the previous slide, tetanus is caused by a bacterium. This bacterium is called the Clostridium tetani. Clostridium tetani is a spore-bearing organism. It lives in the natural habitat of the organism. It can be mostly found in soil and dust. And these spores, as they enter the body through that contaminated wound, it develops into a bacteria. So how is this tetanus diagnosed? Doctors can diagnose tetanus by examining the patient and looking for signs and symptoms. There are no hospital lab tests that can confirm tetanus. The common symptoms that you can find in a person infected with tetanus are headache, stiffness in the jaw, stiffness in the neck, difficulty in swallowing, spasms, sweating, and fever. And now, what is the treatment for tetanus? Tetanus is a medical emergency. It requires care at the hospital, aggressive wound care, immediate treatment with a medicine called the human tetanus immune globulin, drugs to control spasms, antibiotics, and tetanus vaccination. Now, how common is tetanus and where is it found? As you can see here is a 2017 statistic report which is collected from the internet, and according to this 2017 graph, majority of the new cases are found in South Asia and Sub-Saharan Africa. It tends to occur in areas with poor access to healthcare, but now comparatively it is a rare disease in the developed countries. In India, tetanus is an endemic infection. There are certain behavioral factors affecting the disease incidence like hand washing, delivery practices, traditional birth customs, and interest in immunization. So how is tetanus transmitted? Is it an infection that can be transmitted from person to person? No. Tetanus is an infection that cannot be transmitted from person to person. The spores of the tetanus bacteria are present everywhere in the environment, that's including the soil. So these spores, they enter the body through a broken skin, usually through injuries from contaminated objects. And as they enter the body, they develop into bacteria, ultimately causing infection. So this is a pictorial representation of how this infection begins. The different areas of infection are wounds contaminated with dirt, feces or saliva, chronic sores and infections, burns, insect bites, intramuscular injections, puncture wounds like a nail or a needle, crush injuries, intravenous drug use, then injuries with dead tissues, surgical procedures. So whenever you have such kinds of wounds, be careful and take necessary precautions. Who has an increased risk of being exposed to tetanus? Infants typically contact neonatal tetanus at birth when delivered in non-aseptic conditions, especially when the umbilical cord is cut with unclean instruments. Females are more exposed to the risk of tetanus during delivery or abortion, and that type of tetanus is called the puerperal tetanus. Agricultural workers are also at risk because of their regular contact with soil. And this infection is quite common among people with low immunity. There are several national programs for tetanus that is happening in India. The first one is Mission Indradhanush. It's a national program aimed at increasing immunization rate among Indian children against diphtheria, pertussis, tetanus, childhood tuberculosis, polio, hepatitis B and measles from 60% to 95%. The second one is the Janani Suraksha Yojana. It's a program that encourages institutional deliveries and have contributed to reducing the burden of neonatal tetanus in India. Lastly is the Expanded Program on Immunization, EPI, which is an immunization program of pregnant women with the tetanus toxoid vaccine. What can be done to reduce the risk of acquiring tetanus? The first and foremost thing that you need to do, my friend, is that immediate and good wound care. Don't ever delay first aid. Immediately wash the wound with water and soap or alcohol-based hand rub and consult the doctor if there are any serious concerns coming up. The second thing that you need to go for is vaccination. Be up to date with your vaccines. The second thing is you need to know is that tetanus vaccines are available for people of all ages with booster shots throughout life. Here is a list of vaccines that are available. Protection against diphtheria, tetanus and pertussis, against diphtheria and tetanus, against tetanus, diphtheria and pertussis, and against tetanus and diphtheria. Like that, we have come to the end of our presentation, dear friends. Here is a list of references from where I had acquired the information with regard to our topic, tetanus. And thank you for watching. Have a good day.